Thank you. Well, I'm obviously the guinea pig here because I teach in a business school, and my work in healthcare has been on ethical issues in healthcare organizations. And I've been asked to speak on managerial professionalism and what we can learn from that. Well, for those of you who are connected with business schools, you think this is going to be pretty short. Uh, so I've got bad news and then good news on that. Let's see how I change this. How do I change the? Oh, there. To the right. Sorry. So in business schools, they define professionalism in this ordinary use of the word: following an occupation, performing the occupation well, skilled or an expert in what one does. And you all probably do it in this, what I call the jure way, in training, intellectual components, service, credentialing, professional associations, and so on. And now what's interesting is, from a historical point of view, is that in the 1912, Justice Brandeis suggested we need to have those same principles in management. And you can read those for yourself and you'll see how much they're parallel. Again, these were reproposed in 2008 by Rakesh Khurana at Harvard Business School. He got tenure for this anyway. But the bad news is this. Most business schools teach skills. We don't teach intellectual training. Many of them have ethics programs, but the ethics programs, I teach ethics from 8 to 9, marketing from 9 to 10, finance from 10 to 11, and let's don't get too mixed up there. There have been adopted some voluntary codes, but there are no general codes, there are no professional organizations, no prioritization of professionalism, and no enforcement mechanisms, no stopping rules, except, of course, the SEC. So this has led to, obviously, you can see the problem here. I did have to put in a dig against J&J and their hip implant recalls. You know they've had to recall 100,000 hip implants that are already implanted. That's a little slight issue. And then it leads to, I think, what Susan talked about earlier, silo mentalities, both at the business schools, and then we train our managers to think that way. So I'll have someone say, well, I just do marketing, Pat. I don't have any ethical issues. I just do finance. You know, you can do ethics someplace else. So all of that, and one more bad news, but the worst news is it leads to what Khurana has called hired hands. Me too. Good managers, not good leaders, not leaders at all. We're not training people to be serious leaders. And there's a lot of literature on that. If you have insomnia, I'd be happy to give you the references on that. But there's one positive thing, at least, maybe more, to be learned. You can see the negative things. There's some positive things to learn from this. And this is from Global Commerce, and it's from examples of systems thinking. Now, you will probably have read Crossing the Quality Chasm from the IOM, and if you haven't, it's a wonderful book. And you should read the appendix, which maybe you have, which this Paul Pisek talks about. Our healthcare system is a complex adaptive system. I think you all know that. It's just, here's his definition of that. It's a collection of individual agents and public and private organizations that have the freedom to act in ways which are not always predictable. Well, that's an understatement. And whose actions are interconnected in such a way that one agent's actions changes the context of the other agents. Now, what's interesting to me is that when we see global commerce, we see a number of companies adopting this perspective. And let me just show you three. This is not my slide, so we have to wait a minute till it gets done. This is from Novartis. You all know Novartis, the third largest pharmaceutical in the world. This is how they think of themselves globally. They see themselves as part of a global, very complex systemic stakeholder model. The next slide, I think, is more interesting. This is Pfizer Switzerland. Look how they see themselves. They're just, look, they're right over here. They see themselves as part of a system, and they're not in the center of anything. They see them all interconnected, but themselves as not as the center. They've sort of taken out this egocentric view of companies. I find that fascinating. Now, Pfizer USA, okay, never mind. I won't talk about that. But I shouldn't say these things in public. I'm just too old to care. But anyway, but one other I want to show you. Now, this is really interesting. This is ExxonMobil. You all know ExxonMobil. They have now changed their thinking model, and they put energy, which is their business, in the middle. And these are all their partners on the outside. Sorry, it's wrong. These are all their partners around on the outside. but they don't put themselves in the middle. They put what they do in the middle. And I find that very, very interesting. Now, here is a slide then of how some people see the healthcare system. This was made by my graphics person who didn't want to do it. And she said, this is embarrassing and horrible. But I think it describes, and there are many more of these. I couldn't add any more of those little squares around. But you see the idea that we're in a very complex and sometimes chaotic system. And so we need to think systemically. And it's very, very important that we do so. So here is a model. Now, again, I don't have enough. There are more communities in the outside circles, but I didn't have enough room for those. But the question is, if we begin to think transdisciplinary, we have to see ourselves as an alliance of all the various kinds of professionals that are in this room. And if I left you out, I'm very sorry, and we can add another circle afterward. But if you do that, then these are all tribes, if you like. And how do you bring those tribes together in a model so you can talk to each other? Because that's what transdisciplinary professionals got to be about. We can have tribes, but we've got to have central. Well, I put this as a core, no, and this is the danger again. If we don't, that's my old silos again. Notice the right slide, as you see, I guess you saw that. So how do we do that? Well, I've heard a lot of really interesting talk here. I just have one piece to add to that. And this I learned from a bunch of engineers. And this is the example they used. In the Second World War, the United States had to develop radar in order to win the war. So what did they get? They got scientists together, they got even philosophers, I'm a philosopher together, social workers together, social scientists, and government officials, public policy people, all together in a room to think about how to do this. In order to do that, they had to find a way to talk to each other. They were all talking their own languages. And so they developed what they called a creole, a mutually shared discourse developed from different professional languages. And guess what? They vetted the radar in almost no time at all. I mean, relatively speaking, for science. And so one of the things to think about is how do we develop a shared creole across our various disciplines so we cut across our silos. And I think that's the key. That's what I learned from ExxonMobil, believe it or not, because that's what they have to do globally. Now, you may not like what they do, but they do it really well. And they do it really well because they've developed a creole to talk across communities and organizations that is very, very effective. Now, you all will know what that creole is better than I do, so I just created what I thought was at least a shared core value, and that is effective health care. I added the 4 provisos here that's in the literature, but I think we all want effective health care, whatever we're doing. And we may be doing other ways of doing it. We may be teaching it. We may be practicing it. We may be in public health. We may be in all of those things. We may be in organizations run by MBA students that I probably trained and you hate. But they have to talk to us too. They have to get a creole so we can talk to them. That's critical. Otherwise, you're going to continue to have these silos where managers are telling you to be more efficient and your healthcare professional is telling you to be more effective, and you're not talking to each other, you're talking at each other, and we're really good at that. Well, how do we do that? I'm not sure, so this is my last slide because you all are better experts than I am, but one of the ways is obviously doing some of the things that Jacqueline was talking about, and Susan, have short cases and have people talk about them from their different perspectives, and listening. You had wonderful ideas of listening, and analyze different ways, listen to our narratives. We don't always listen to each other. Listen to the narratives of different people. Translate, come to some consensus, and then come to some values consensus. And as one of you said earlier, there's values differences too. We're all agreed on basic values, but we prioritize them differently. And I think to recognize that is a huge step forward. And it seems to me, at least this is what I teach to my international students, it's all right to disagree on prioritization of values because we prioritize, and that's all right, as long as we respect this difference of prioritization. Thank you.
All right. So thank you to all of our presenters. Some really challenging and interesting ideas. So I'd like to begin with asking for a question from one of the individuals who's currently enrolled in a regular standard academic program, since we're all students in general. So could I have one of you ask a question of our panelists? Mm-hmm.